As a patient, I think you should feel comfortable asking your doctor all the questions that are important for you to plan. For instance, talking about bills or cost of care is absolutely fine.
It might be hard for you to do that because there's so much going on when the doctor is talking to you about your treatment options. A lot of information to absorb, a lot to understand, and you want to hear about which treatment is going to work best, what kind of side effects you're going to be dealing with. But cost can be an issue, and sometimes treatments can be decided on the basis of cost. So at the point that you're making this decision, it's fine, and we really encourage people who are starting treatment like you to ask that question: is there a difference in cost among these treatments you're presenting?
And you should be able to have a frank conversation. Perhaps your doctor is not the best person to answer all the questions, certainly may not know the specific answers to questions that relate to your insurance or the costs of certain therapies, but he or she, your doctor, should be able to point you to somebody on their team, or perhaps other community resources that are available to answer your questions. Everything that's important to you should be discussed frankly and openly.
The best time to talk to your doctor and your healthcare team about cost is before treatment begins, so you can anticipate what this might mean. But it's okay to bring this subject up at any time along the treatment process.
As a patient, you may feel that there is another burden that complicates your treatment, and that's all the bills you get and all the paperwork you get. I'd suggest to you that you keep track of it. Either have a folder, or perhaps you can delegate somebody in your immediate circle, some relative or a friend, help you with it, but stay on top of it. Ask questions. Make sure you don't fall behind, because otherwise you might find that you have even more problems when you end your cancer treatment. I'd suggest that you get organized with your bills and do this on a parallel track with getting your cancer treatment, to just stay on top of it, collect the information, make sure you're in touch with your insurance company, and that all of these things are attended to and that you have a plan.
There are resources for people who are being treated with cancer who are having problems with their bills and are uncertain about what's available to them and what they're eligible for. There are a number of nonprofit organizations. There's a lot on the internet.
You may want to look at Cancer.Net and see what our resources there are. There are links to community services. There may be specific individuals in your doctor's team who have experience with this, sometimes a financial counselor or a social worker or somebody who's designated to help you to navigate the system, which can be very complicated.
It probably makes sense to ask wherever you're being treated where they would recommend that you go for information and for help.